Good night, Dorian. How are you? How was your day?
Good night, and doing well. Yeah.
Great. As always, you're the first one. And then we should wait a little bit for your classmates, okay?
Okay.
Just as always, 10 minutes, I think, and then with the people we get together, we start, okay?
Okay. No worry.
Okay, let's have a little bit of patience. Thank you. Okay, can you watch my screen?
Yes.
Yes, teacher.
Okay, great. Let's go ahead. Well, as you know, tonight is our last theoretical class, and well, tomorrow is our final test from Module 2. In this theoretical class, we are going to check ways to read, to understand all the parts of research articles about abstracts, how they are done by, well, I mean, it's a structure, how to show conference presentations, and how to show case presentations, how to prepare slides. It's a very fast view with the most important details and using, of course, abbreviations. Well, a research article is, of course, a very important topic in our job, because from that articles we can understand new research, new findings in our career in medicine. So the meaning of this is a journal article in which the authors report on the research they did. Always they are primary sources when we want to learn or to catch more information or continuously becoming up to date, because it's important to get the resources done properly. Whether or not a research article is peer reviewed depends on the journal that publishes it. I mean, it's not the same purely a Bolivian journal than European journal. Maybe parameters could be different, or maybe some details are not the same at the moment to evaluate the information you are publishing, right? When we talk about its structure, we must consider these 4 parts that are very important, these 4 sections. The IMRAD structure, I mean introduction, method, results, and discussion. If you got these 4 sections, you can say that your article is well done, is correct. About the IMRAD, let's consider the characteristics of each one. In the introduction, always you get the background information. Okay, remains the reader what is known, maybe history, or how the situation, the disease was discovered. Everything you consider important at that time should be in the introduction. Of course, it includes information about previous studies for getting a point of view of a previous one in order to compare your results from these previous ones. And then explain what has not been investigated previously. I mean, new points of view, new points on this research. And there is usually a statement of the objective. You have to show what you are looking for with this study and why you pretend to make again and study with a different point of view or completing information. About methods, well, we usually give details of people who are a part of the research. We explain the universe. We show the complete information and the variables we prefer to use. Of course, it has to contain information about any intervention carried out. It must give details of the steps taken in the study and how the participants were chosen. I mean the criteria for being included into this study. That includes the main things measured, again, variables, okay? Of course, the results show the findings of the study, show all the new things following the objective, non-different ones, because you need a point of view, you need a point to check, and then following that information, you can give the results properly. About discussion, it contains explanations and claims for the importance of the study. You emphasize why you did it, why you considered it's important because of this new point of view, or why you consider it should be done again. Limits, you make a list of limitations or unsatisfactory parts of the study, all the troubles you get while developing the result, all the problems. You suggest what research needs to be done in future, okay, new points of view, or maybe new questions you are finding from your own study, not from previous one. All of these suggestions come from the study you develop now. And there's usually a conclusion as a separated section. It's not a rule to give a conclusion, but if you got it, it's a separated paragraph maybe. About the acknowledgements, here authors thank people who have helped in research, usually by teams, right? And of course, references that sometimes we think they are a lot, but certainly they have to be a lot for being a trustable research. When we talk about objectives, we consider these following verbs as the most common ones in order to check the objectives we are looking for. For example, assess, and we talk in past, we assessed whether, determine, the aim of our study was to determine whether, or investigate. We investigated the, or evaluate. This study evaluated them. Why in past? Because you made your study in a period of time. You collect information, you prepare all the information you obtained, and then you show your investigation when your article is done. Of course, it's not at the moment that you are giving the article, you are developing the research. It's not the way. That's why you have to talk in past, because all the actions were in past. Sounds obvious, but sometimes we find in grammar details that they're in present, and it's a huge mistake. About the main findings, well, all of them are usually in the discussion section at the beginning, as a paragraph, sometimes as an introduction or supporting the introduction. It's related to the objective, of course, because you are following your point of view, you are supporting your point of view. And the most common verbs that can be used for showing findings are this list. Show, we have shown that, confirm, our study confirmed that, provide evidence, these findings provide strong evidence that, or if results are less certain, you can say, suggest, the results suggest that, or suggested that, or in a negative result, we can say fail to. This study failed to show that, right? Getting these verbs, these ways of expression is easily to catch how this article could be properly translated maybe, or could be properly understood. About abstracts, we all had the chance to get articles and prepare abstracts from them, and prepare specific information that we must show. That's why an abstract is a summary of a research study that allows readers to quickly learn about the important aspects of the study. I mean, we don't give all the details in the abstract. We just focus on the most important facts that you get during your study. We prepare a small paragraph in the introduction and the abstract. You get always the abstract at the beginning. That's the way it should start. In medical journals, An abstract usually presented at the beginning of the published article because they have to call attention of readers and give the general point of view of this, but trying to get more importance and showing specific details. And well, of course, trying to show or to help us to get the correct point of attention and let us to read the complete article. They are also a main vehicle of communication at scientific meetings. We got to say to, we got a way to get in contact, in touch with lots of researchers from all over the world, and then we learn from them. But if you write down articles, if you learn how to do it properly, if you had the chance to publish it, you change, you're giving a new point of view and change the way it works. Following an example, the British Medical Journal structure abstract is divided into the following sections. All of the sections should be in the abstract, I mean. You have to show the objective in one sentence, the design, I mean, if it's prospective, if it's a cohort study, what kind of a study it is, the setting, the place, of course, the subjects, I mean, the universe of patients you are studying, the main outcome measure, all the details you found during the study, the results, I mean, all the statistics in one or two or three sentences, just the most important facts, and one or two sentences by a conclusion. Getting all of this information, you realize that you get an example like this. Just for catching vocabulary and knowing that you got the verbs we were talking about at the beginning. Age retirement and long-term survival of industrial populations, prospective cohort study. The objective, then you get it. The design, long-term prospective cohort study. The setting, petroleum industry in the United States. Subjects, a universe of people with all of the details, with all the ranges and variables you consider. The main outcome measure, how you got these details prepared, these details in count for being into the research, the results, just the most important ones, the ones that are showing or supporting your objective, and conclusions, of course. The big one, okay, one or two sentences, no more than that. When talking in conference presentations, well, we all had got the chance to be present in one conference presentation, always during our career, or maybe when we finish and we decide to focus on a specific branch. In order to stay up to date, we have to attend conference presentations all the time, as much as you can, because that's the basis of your own self-study job, right? A conference is a meeting, often lasting a few days, which is organized on a particular subject or to bring together people who have a common interest. As you know, I love emergencies. And into this topic, I love the management of pain. In that way, almost all the conferences I've been attending are about management of pain or management of emergencies. Or maybe a combination, pain during emergencies, yeah. It depends on how I decide to schedule, how I decide, or which societies I'd like to follow on, right? And conference presentations provide great opportunities for you or for us to communicate your research to a wide and interested audience. If you got the chance to be to present your research, it's great because you are a little bit getting in in a big league, we can say, of researchers, and you get the chance to show what you certainly want to give into the medical branches, right? Of course, you get feedback on your work from more experienced colleagues, of course, always, and that's a very humble way to understand, to learn, and to exchange information. You learn from other presenters and broaden your professional network. You open doors for job everywhere in the world. Tell you by experience, it's a good way um, to start in this kind of activities, right? Preparation and practice are the key to getting the most out of these occasions. Why practice? Because you usually get just 15 minutes to show your presentation, maybe 20 according to the topic and according to the conference you're attending. That's why we should consider this as one of the most important activities that during the career we should practice a lot. But well, our reality is that it's not the way it works. And we don't learn how to write down properly because we got lots of different topics, the basis in medicine. But as soon as you can, try to catch all of this information and learn how to do it. There are lots of courses on internet by free. When we think about the structure of a presentation, I mean a conference or congress, presentations are typically divided into the IMRAD sections, same, right? Introduction, methods, results, and discussion. If the presentation has a different way, has a different form, different structure, the speaker, the presenter, has to outline this structure, has to show why it's going to be different from the IMRAD. This helps to orientate the audience and, of course, to understand what they are talking about. The way to start giving information, well, here you got some expressions. For example, I'll begin by, and then you give it. First of all, I'll then, and the way to continue to connect ideas. Secondly, I'll, or at the end, finally, I'll. So as you can see, we are introducing the idea, we are showing the order of the presentation, and we prepare audience to changes. Another way to start a new section with a signal could be, now we are going to see, or we are going to check, or moving to X, or moving to this second point, or you can say, as far as, I don't know, as far as this result is concerned, we can find, and then, right? There are expressions that show us that the topic is opening, is giving us more details, is showing us more information. An alternative technique to use, of course, are questions. Questions to call attention, to show patients that are important, to show the audience that is important to ensure details. For example, how did we investigate this problem? Why we decided to investigate this problem? We introduced the method, maybe the motivation because of them, why they decided to do it. Or we can say, what did we find? The result. Oh, what about the results? And then you start talking about the results, about all the details you found. Or how does this compare with previous studies? If we compare previous studies to this, and then you give the discussion, you open the door, you open the ideas, and it's possible to make it properly, getting more audience paying attention to your speech. Well, the introduction, the way to start, you get many different ways to do it. The formal way, Could be this one. I'd like to present to you the results of our research into, and then you give the specific topic. When you go, or when you have the, the possibility to attend international conferences or congress, always you're going to hear this presentation, this introduction. Why? Because it's a very formal event. I'd like to present to you the results of our research. And then they start talking about the title, and as a fact, they talk about the introduction. Or on the other hand, many speakers prefer to begin in a less formal way, a very common way. And we start talking in a casual form, okay, giving details as you were talking by friends. When we first began to look into the question of X, we thought, as a group, we decided, or we noticed that this trouble was reaching, so we decided to study it, for example. Or maybe with a generalization or reference to shared knowledge. I mean, we can say it's well known that many studies have shown that, or X, this topic, has established clearly that could be an example, right? For example, when we talk about specific changes in protocols, we can start with this generalization. We can say the protocol ABCDE, when we assist pre-hospitalian trauma, has established clearly that we can provide more possibilities about the survival probability in length. But our study shows that if we assist bleeding at the beginning and then we continue with the ABCDE protocol, we got this new rule, X ABCDE. That could be an example how to start an introduction on this specific ways of expressions. About signaling, you get specific expressions that can show you how to give importance, or how to show great ways to emphasize information. For example, just emphasizing, just giving more importance. I'd like to emphasize. Easy, very easy at this point. Or maybe listen points. Firstly, secondly, and ahead. Or maybe referring to slides. This slide shows, and then you talk about the information that patient, the audience is checking. Or giving examples. For instance, such as, right? Or as you know, a resource that I love to use, contrasting information. On the other hand, in contrast, however, okay. About the conclusion, well, of course, we have to end well. We have to end properly, giving examples in a good way. Okay. For example, well, we have to sum up all the conclusions, all the information that is important. And we got these expressions. So, in conclusion, to sum up, finally, some examples we can see. I'd like to say end by this studies show, so you can notice that's the way. And if we think on this, all our professors use the same structures to talk during the med school. Case presentations, a very nice topic, because we get the chance during the career, when we finish the university and start working, we have to show information, we have to talk with specialties, where we have to talk with more experienced colleagues, and almost all our topics while we are on duty are case presentations. I mean, we got a formal communication between healthcare professionals, such as doctors and nurses, regarding patients' clinical information. Could be, or maybe between doctors, right? Of course, it's essential part of a case presentation. It includes identifications, reason for a consultation or admission, right? It should be chronological and detail the history, of course, the physical findings and investigations followed by the patient's course. We all know about it. During job, we got the chance to prepare this. At this point, we may include, we may wish to include more details that we have time to present, or we have to we have to prepare, we have to organize ideas. It's not go and make a speech so crazy without an order, because it shows how we certainly work. That's why I got this chart. In this chart, it's an example how it works. We got lots of sections that very common all over the world are the same. And examples to catch the way it works. We got the introduction. For example, I'd like to present Mr. Simpson, patient's age and occupation, presenting symptoms and duration, associated symptoms, the past medical history, PMH, social history, family history, findings during the examination, investigation results, diagnosis, treatment, and the outcome. Checking all of these steps, we are sure that we are not going to waste our time or lose information with our patients. That's why it's important to be clear that all of these details are a very important point of view to catch the correct information. And as you can see, for example, in findings on examination, we know on exam, and we start giving all the information into speech, into paragraph, or about the associated symptoms. He also complained of, as you can see, it's in past, the way we were talking about his model one. Or we can say about, for example, investigation results. We did chest x-rays, which showed, as you know, it's in past. Grammar details that are important at this point, expressions that are the basis of our proper communication. Of course, the bedside presentation, in my opinion, a very good exercise if we were taught how to do it properly and get on practice a period of time. But it's a very stressful moment when we get as students or as an interns, maybe as a residents, because, well, that's the moment when professors prefer to kill us, right? Of course, it's a less formal type of case presentation that take place at the patient's bed during the ward rounds, or maybe when we receive a new patient and the consultant, the specialist in charge, has to go to evaluate, we have to prepare the bedside presentation. In the teaching ward round, we all had the chance to be there. The ones that didn't take this experience yet are going to feel by the skin how it works, how stressful it could be. And of course, medical student has the chance to start with this. They give the introduction similar to the one that is in the bubble. This is Mr. Simpson. He's 34 and he's a plumber. He came into hospital yesterday sent by his GP. He is complaining of breathlessness, which he's had for 1 month round, for example. Why we talk here in present, in the bedside presentation? Because the patient could be at that moment with the symptom. Could be suffering. That's why he's admitted. If there was a solution, there was no reason to get into the hospital, right? But if there is no solution, no response to medication, well, it has to stay. And during the ward round, of course, the patient has some symptoms that are supporting his presence in that room, in that service. In that way, we prepare the bedside presentation, we got all the observation, we got details, and we decide that that's a medical case that we should study by a group or maybe by a class, and we have to prepare slides. Well, slides have a structure. When you get the chance to practice how to do it, in a formal presentation, the main points are usually summarized on slides. You can see we all get the chance to do it, but you get this order, this example to do it. We give the general information, name, age, and occupation, similar as case report. Complaint of, and then we just give symptoms, following by abbreviations, always. Dyspnea, 1/12, I mean 1 month per year, 1 month. Why we know 12? 12 is telling us that it's about a year. Ankle swelling, 2/52, 2 weeks. Why we know it's 2 weeks? Because 52 weeks are in the whole year. Married with one son, social history, and he gets 25 cigarettes per day, 50 units of alcohol per week, okay? Why we say units? Because that's a way to measure alcohol in some countries, in this case in UK. The personal history, or past history, nil, nothing relevant, and family history. Father dead, 42 years, myocardial infarction. Mother alive and well. On exam, we found he was obese. He got 2 spider nevi on chest. Pulse 110 per minute, it's regular. And blood pressure 100/60. The CXR chest X-rays, enlarged heart, and bilateral pleural effusions. The most important information just. If you got some labs, you add LR, lab results, LR just, and just give me the results, just the conclusions. For example, anemia, and in parentheses the value. So for example, hemoglobin could be an example, okay? Now you got a general, very general way to show this information. So that's all for tonight, a very short presentation. Great job, continue doing this. Don't forget that this course is just showing us the basics on medical English, and we all got the possible way to keep on reading and learning more. So, patience, okay? Let me show you, let me send you the pool to take attendance. And, okay, great. Okay, it's done. Tomorrow we have our final test, as I was telling you the whole week. It starts again at 8 o'clock. It lasts 2 hours, no more than that. From 8 to 10. I am sorry. You send me your answers or you print the file, is your choice. You send me a PDF file similar to homework files. But now I'm gonna be so strict. If I cannot read, if I don't understand the handwriting, or I cannot check the picture properly, I'm not gonna take in account the answer. Why I'm gonna do it in that way? Changing the test because of all the situations we got with the writing exercises. So please take it in count. Me on time, because if I'm alone, well, doesn't matter. The test starts 8 p.m. o'clock. Any question about it, maybe? I don't think so, right? Because it's clear you got an experience. Maybe I'm gonna ask about the key report, because you got that kind of exercise doing this model 2 also. But I'm not gonna ask about the letter of referral, the physical exam. Okay, so let's consider this. So let's close this one. Okay. At this point, that's everything. Any question maybe? On Friday during the day, I think, if my connection is working properly, I'm gonna send you the scores for model 2, and as you know, the minimum score is 51. If you cannot reach 51 on the test, if you cannot reach 51 on the test or in the final test, well, it's according to the promedium, and I'm gonna show it to you. I'm sorry. I'm gonna show it to you in order to complete all the details, okay? Okay, then. Well, the material is in the WhatsApp group, but well, I can send to you, Jackie, but I did it yesterday. Both presentations I sent you yesterday, Jacqueline. Check your WhatsApp, please. Because now, well, we are on the day here. We're late, okay? So I think that's all. If there are no more questions, or if there's any question, any different detail to talk, I'm here. That's the moment. Tomorrow I'm not gonna answer anything. No questions? No questions. Perfect, Pablo. Thank you. There is no way to exchange the date. I'm sorry, because tomorrow my contract job is finishing. In that way, we finish the test, I send the scores, and I finish with the institute. That's why we cannot exchange dates. If there is a question, maybe a doubt, we cannot work in the same way that in model 1. It's out of my hands completely now. I'm telling you that for being clear and not getting into confusion at the moment, okay? If there are no details to talk about, well, I think we finished. Okay. Something to tell me, maybe? Nothing? Okay. That's all for me, that's all. So, have a great night, and any question? Well, now was the moment. The question is over. Okay. Have a great night. See you tomorrow.
Thank you, doctor. Bye.
Bye-bye.
Bye, teacher.
Bye-bye. Have a great night. Okay, Elena. Bye-bye. You're welcome. Okay, bye-bye. Bye, Dorian. Bye-bye. Okay, Jimena, let's close this. Okay.
Thank you, doctor. See you tomorrow.
Okay, Jimena. Have a great night. Bye-bye.
Thank you very much.
You're welcome. Okay, everything is done, so let's close this. Have a great night.